introduce the next stage, the innovative projects that were selected together with the other ones that we will listen to later on from all over the world. Projects in order to solve the COVID-19 problem. So I'm going to introduce all of these projects with a special guest we're going to introduce with this video. Georgia Palmas. Hello, Georgia. Hi, Cosmano. Good afternoon, everybody. Good afternoon, all the guests that are connected with us. Good afternoon. People are following us not just from Italy, but also from all over the world. So your voice will be translating to English as well. But you're calling from Milan, right? Yes. I'm calling from Milan, from my home, where I am, of course, locked up in since a month or so, following the rule, applying for everybody. And I've been listening very actively to the previous speech. It was very interesting, the impact of e-commerce and the fact that we are experiencing a very difficult time, a tragic period of time from many points of view, but a period of time that can be an opportunity for us. And the opportunity starts from awareness. The awareness of how we've been living so far and how we will choose to live from now on by complying with rules today and setting new rules for tomorrow. Yes, that's true. We can do that. And we can also hope that these innovative projects will be implemented because they can really solve the coronavirus problem. So together we will present 2016, we've introduced WMF Day, the startup competition. Now we're going to do something very similar because these are also very innovative projects and we're going to present them in a different way because you're at home and I'm here. So remotely. But let's see, we've got new projects, new startup projects, and there are 9 projects. They want to support, they want to help in this coronavirus emergency and support all the people that are involved. So, Cosman, if you want, we can start straight away with the first one, the first startup company, which is Pagine Mediche, medical pages. And we will have Antonella introducing the project. Antonella, are you there? Can you share your screen with us, please? Here she is. Please switch on your mic. So, we've got a small, short delay, but we can hear you. Yes, we can hear you. I cannot see you, but I can hear you. Can you see my presentation now? Yes, we can. I can see, yes, we can all see it perfectly. Pagine Mediche. So let's start with the first startup project for today. We're very curious about it, about your project. Just 1 second, Georgia. I'm gonna be a human countdown. After 3 minutes, I'm gonna stop the presentation, okay? Okay, perfect then. Pagine Mediche is a digital health platform with over 2 million users every month, which aims at connecting doctors and patients. So we wanted to be active in order to face the COVID-19 emergency. This is why we made our platform available with a set of innovative services. First of all, we've developed, starting from the government guidelines, an info chat, which really simulates a conversation with a doctor and makes it possible for patients or people to understand what the right behavior is based on the indications we get from our government and from the healthcare system. So you get right, correct information without overloading telephone lines, and you get medical help in order to understand also who people have to contact to get in touch with, so the local physician, for instance, or the regional emergency number, and so on and so forth. 100,000 people have already interacted with our chatbot. Our project is part of the Solidarity project, is sponsored by the Lombardy region. The region also uses this platform to gather information, to gather data. So we help in the epidemiological and retrospective analysis in order to cope with the COVID-19 emergency. For suspect cases, for patients who have symptoms but are still at home, there is a monitoring service we have implemented in order to support healthcare professionals and families who need some monitoring and some support. So we have clinical reports for every COVID patient, which is shared with the doctors, containing different parameters in order to better manage the case remotely. And as soon as these parameters get to a threshold value or they overcome the threshold, some alerts are sent to the physician who can possibly activate a video analysis or inquiry with the patient. And this is a service that we send it to all of the Italian physicians. So they really have access to our platform and they can use our service free of charge to visit their patients via web, via hub, and everything's reliable. Of course, it's GDPR compliant as well. And everything in a very short time. So 1,400 patients are currently managed with a video visit inquiry. So this is it. Thank you very much for your attention. Thank you, Antonella. Thank you. Georgia, what did you say about this project? Well, Cosmano, I have to say it's very interesting for many reasons, because in a time where we're literally bombed with suggestions, rules, indications, having a direct connection with our doctors to understand what the right behavior is, then this is very good, not just for symptoms connected with the coronavirus, but it's a direct connection that makes this application very interesting.